So the role of a receptionist is to be aware that there might be a problem, to nurture the patient and to flag it with the doctor if there's any concerns.
It's really important that our medical receptionists let us know if there's a problem, if they have concerns about one of our patients.
Receptionists can pick up that someone's just missing appointments, etc., and raise the question.
Dementia is a slowly deteriorating brain condition that affects the person's memory, thinking, communication, and ability to undertake daily tasks, such as managing their healthcare.
Dementia is defined as a syndrome. It's not a pathological diagnosis, but it's definable only because there is a change to functional performance.
1 in 12 people over 65 have dementia. This rises to 1 in 4 over 80. This means that a quarter of people attending a general practice may have dementia.
Nobody has lost their wisdom because they've got dementia. Nobody's lost their identity because they've got dementia. They just need support.
Getting the times mixed up for their appointments and the days, whether they can understand that it's just for a basic appointment or something longer. They get themselves a bit tied up about that. Lots of times they will always say, I asked for 3 scripts and I've only got 1 piece of paper. Some of them will call and say, I've got to do that thingy with the clock, so their memory's not understanding, so they might forget their address when they get in the taxi. We can actually send a note to the doctor. So I can say, Mrs. Smith has rang 3 times today, she's forgotten her appointment. So we flag it and the doctor or the nurse can do the rest from that.
I, as a practice nurse, would convey the information between the receptionists and the GPs and ensuring that it's all very clearly organised. But that's something that I think that we pride ourselves on, is having really good communication between us as a team.
There's not a protocol as such, but it just comes with experience to check those trigger points instead of the receptionist getting frustrated and saying, there's an old lady on the phone, she keeps ringing because she's getting her appointment. So you've got to take duty of care then and say, well, there is something there.
We estimate that half of people with dementia don't have a formal diagnosis. That's why general practice is so important.
Our whole team is really important, and everyone picks up different bits of information, and all of those bits of information are part of fitting the puzzle together.